We're talking about suppressing your appetite, and I'm going to show you some other ways to suppress your appetite that I will use, but I'm keto adapted. I've been at this for a few years. My metabolism will quickly go from one section to the next. So let's move on to, if you are keto adapted, that would be somebody like me, been on the ketogenic diet for a while. I've been doing some, like I've got this book I'm trying to finish. I have to have times where my brain, I've only blocked off 3 hours to work on this. I need to get through a couple of chapters. If I fail, I don't have another spot in my schedule for 3 days. So it becomes very important that I get my brain focused, not distracted, and that means turning off a lot of all the things that distract it, but it also means finding a way to fuel my brain in a level that hunger is not distracting me, that I really am satisfying the needs of my brain, and I can really punch through and get done what I want to get done in those hours. So for keto adaption, you can make or swallow the ketones. So in tonight's case on the show, you can see me swallowing ketones. That's Ketones-In-A-Can. That's all the products that are on the market that say yes. Very important little trick to use. What I encourage people to do is no matter what product you use, if it's mine, if it's anybody's, be sure to check your ketones 30 minutes after you take them. I am so impressed with, again, I did not wake up one day saying, I want the headache of making my own products. I just was frustrated that I would have patients spend this insane amount of money, and the amount of ketones that are in one scoop of this highly expensive powder was ridiculous. And then they had all kinds of other ideas, throwing in B1 and B12 and all this other stuff that just was filler. I'm like, I don't want that. I want them swallowing ketones. Ketones was the key. Don't screw it up with all the other distracting things that go in there. So swallowing ketones is one way. Making ketones is another way. How do you make ketones? We're going to show you in a second. Swallowing medium-chain triglycerides. Medium-chain triglycerides, specifically the ones with 8 carbons or 10 carbons, are very easy to absorb, not digest, absorb. For my patients who've had gastric bypass, I push them to say you gotta be teaching your gut first how to absorb MCT C8C10. And I'm not kidding, I have them swallow 1 capsule. I actually have them bite it. And so that's the soft gels that have C8C10 in them are a tiny, tiny, tiny little dose. I tell them, put it in your mouth, bite it. And that is enough oil for some of them. Some of them still get diarrhea from that. And that is just a reflection of how damaged their gut is. A lot of those patients are the ones with gastric bypass, and they just can't seem to find a way forward. I am highly encouraging them to say, you got to swallow the ketones for a little while. You're going to have to use MCT C8C10. And that process of enhancing what those ketones are doing on the inside suppresses their appetite, but also is like baby step number 1 for getting their brain back to where it should be. Okay, let's keep going here. So the next one is eat fat. So if I didn't have supplements, if I didn't have a way to hack my brain, and I was, again, preparing to say I need to focus for the writing session that I was going to do or whatever, I would want to eat fat a couple of hours, and you heard me say that right, a couple of hours before I want my brain to really be in that hyper-focused place. That eat fat without carbohydrates, especially if you're keto adapted, is an excellent way to raise the ketones and really increase the production. But one of the reasons that eating fat and fasting both suppress appetite is because of what it does to your fat-based hormones. Fat-based hormones that suppress appetite include things like cholecystokinin, peptide YY, you've got the leptin, ghrelin, yin-yang that suppresses appetite, shuts off hunger. The layers of fat-based hormones that suppress appetite, there's about 15 of them. You can't make them or you can only make a minor amount of those fat-based hormones when you're in a high insulin state. In my patients with chronic inflammation, with malnourishment from a gastric bypass, I want their fat-based hormones to be surging as high as I can get them, because not only does it bathe their brain by decreasing the anxiety, decreasing the signal to want for food, but it is a powerful transition when the fat-based hormones are surging, that you also have that improved mental performance, that concentration, depression is less, anxiety is less, the scatteredness of your brain is less. Those fat-based hormones come in a state when you're keto adapted, and as they surge, you really do have a decrease in appetite. And again, you can measure that. Say, well, doc, is that me? I don't know. Am I fat adapted? Am I keto adapted? And if you haven't checked out the online course where I really go through this step by step, you can peck around on YouTube and find lots of my videos that teach this. But if you're looking for the most succinct, no, cut the crap, stick with the message, don't get distracted. You've got tiny little videos to get you from the beginning to the end. That's really what this book is that I'm writing, is a stepwise process of how did I take this patient through this journey of a brain that was not working right and good 50 pounds of weight that needed to be lost, and how did we journey these 2 to 3 years together. What happens as the patients get better and better at using fat and surging those hormones is not only did their body get more adapted, but they learned that keto adaption, you can have the first layer of keto adaption, which is probably 2 weeks into the ketogenic diet, and then your body gets into a plateau, or maybe not a plateau, but it just kind of stabilizes. And unless you push a stress into your system again, people can be keto adapted, but they can regress back to a less adapted phase if they don't find a way to keep exercising their mitochondria. So measuring your numbers is a super important, valuable tool that gives you the freedom to say, how am I doing? And you don't need my answer. You can check yourself. It does come with some knowledge. If you haven't taken the online course and you're looking to come that to get that level of confidence or education behind your ketogenic journey, I would. It supports the channel, but I'm very thankful of how well it turned out and how many patients, actually just not even patients, people that have watched the course, took the information back to their doctor, and their doctor is learning how to get their prescriptions stopped, to decrease their blood pressure medicines, decrease their diabetes medicines, and get that weight off, get their brain back because of the ketogenic chemistry that they're using. So again, if you're looking to suppress appetites, you can use stimulants. Those are coffee. That's everything from cocaine to Adderall or stimulants, but they have tachyphylaxis. You can use them very effectively to suppress your appetite, but the longer you use them, the less effective they are. You can raise blood ketones by shifting your metabolism. You can shift metabolism by exercising, by changing your body temperature. You can either heat it up or decrease it by getting it cold. That's somebody actually, I was watching one of the comments said, did she really take a mud bath? Yes, I took a mud bath. I used bentonite clay, and I'm fascinated by how awesome my skin was the next day, but it also was just I didn't have like an ice bath or anything. It was just cool water after that hot sauna, but I know that it burned through a bunch of my ketones and glucose because I slept so well that night. It was 72 hours into my fast, and I didn't wake up at 2 in the morning with the high levels of ketones. I got a good set of numbers the next morning, but it wasn't that middle of the night awakening from an overshoot of my ketones. If you're not keto adapted, the way you suppress appetites is you swallow your ketones. If you are keto adapted, use some of the hacks that I went through. I have found that the better I get at understanding my own system and really fighting the world around me that says, oh, you've already fasted 6 times this in the last 6 weeks. Do you really need to do this again? And there's a little devil on the shoulder saying, no, you stop it. You've tried this enough. Ugh, I don't like fasting any more than anybody else. But I will tell you that as I watch what my metabolism has done, as I stabilize, and then I push I think of fasting as a workout for my mitochondria. And that process of stressing my mitochondria and working them out is a way to ignite the autophagy, the recycling of my system, so that I don't end up with a chronic brain problem, so that I don't end up with an autoimmune problem, that the chronic health problems that I've studied in my clinic for 20 plus years that I didn't believe were as preventable as they are, come with how good of shape are your mitochondria in. And one of those ways to stress the shape of your mitochondria comes with how are your metabolites? What is your metabolism? Again, that gets you back to the Dr. Boz ratio and checking your numbers, which we will do here before we close out the show.
Please subscribe to my channel. And don't forget to click the notification bell so you don't miss out on any new videos. Stay tuned.